Hey, how's it going? Nick Goodwin here. I'm here to talk a little bit about side effects of psychotropic medications and how to cope and deal with them without having to add medication. Or if you have already added medication, but yet it's still not quite getting rid of the side effect, how to use other interventions to try to get you for the rest of the way. Psychotropic medications have a lot of side effects, and some of them are pretty common. Some of them will go away, some of them don't. But depending on what medication is and what it's for, sometimes the side effect is worth whatever the benefit of the medication is. So I'll give you guys some tools over the period of 4 videos. The first one we're going to talk about is nausea. Some things to keep in mind for this video is the scope is not just general nausea or nausea due to pregnancy or surgery. It's really specifically nausea caused by psychotropic medications, often the SSRIs or the antidepressants. I'm not going to speak to pregnancy, even though plenty of pregnant people are on these medications. If you are pregnant and interested in the safety of these interventions, feel free to comment, ask me, I can reply, or you can check out that Medline article I posted down there in the comments or in the information for this video. And the author of that article goes into great detail about pregnancy safety. The other important thing to talk about is that just because you started a medication and you have nausea doesn't necessarily mean the nausea was due to that medication. Nausea can be a sign of other really serious medical conditions. And so if the nausea is due to the medication, often it'll come on pretty quickly after starting it or after raising the dose. It will not be associated with other symptoms like abdominal pain or fever. And over time, it usually will get better. If you don't have that, it came on maybe inconsistently after medication, it has intense abdominal pain, or it's getting worse, then go see your nurse practitioner or your provider or your doctor to go get a workup. But if it is benign side effect related nausea, I do have some tips for you. And so using one of these sometimes won't work. Sometimes you got to use multiple ones. And also a lot of times I hear this, Nick, I've already tried that. Well, my response is, have you tried it again? Maybe you weren't using the right brand, maybe you weren't using the right dose, or maybe it didn't work then, but it's going to work now, or maybe it'll work now with all these other interventions. And so sometimes it's worth another shot. Okay. Step number 1, and this is hopefully something that you've already talked about with your prescriber, but it's important to take some of these medications with food. Not all of them. Like thyroid, for instance, you want to make sure you take on an empty stomach. But for instance, the SSRIs or the antidepressants that often cause the nausea, it's important to take it with the first big meal of the day. A lot of my clients come with nausea after they started an SSRI and ask them, what are you eating for breakfast? Oh, I don't eat breakfast. Well, I should have asked that before I started you on it. The truth is, you got to eat it with the first big meal. That's lunch, then it's lunch. That's fine. Pushing it out to dinner, you probably want to talk to your prescriber about it and understanding that it can mess with your sleep cycle. Sometimes it's appropriate to dose them at night. So make sure that you talk to your prescriber about whatever medication you're on and make sure that if you do want to take it with dinner, it's okay to do so. Intervention number 2, and we're going to talk about ginger. Ginger is very well studied for nausea. And so you can kind of go to a health food store, or I've got this at Rosar's. I was hoping to find one that had a higher milligrammage, but what they really found is ginger at about 1,000 milligrams a day can really help with nausea. These little tablets are 250 milligrams each, so you have to take 4 of them. That's kind of a conversation I always have. And how many did you take? Do you look at the dosage? Do you look at the milligrams? It's all very important. You only take 1 of these a day. That might be the reason it didn't help. If you want to do there's a lot of other ways you can go about it. You can grab tea. I got this tea. This is a pretty high potent tea. This actually is 1,500 milligrams. So one of these tea bags would get you to that dose. A lot of times tea is not this potent. And so you might have to drink upwards of 4 to 8 glasses of tea in order to get to that 1,000 milligrams. Intervention number 3, which is about as close to medications as we're going to get, is vitamin B6. Vitamin B6 is an ingredient in some anti-nausea medications, so it's been well studied. It's been shown that between 25 and 75 milligrams can be effective. I have one here that's 50 from Pure Encapsulations. They tend to be a little bit more spendy. And I have another one here I got at like Super Supplements. It's 25 milligrams. You start at a lower dose and move up. High doses of vitamin B6 has been shown to be causing neuropathy, which is a big deal. And so you really want to avoid the high doses of it. An author I like to follow, James Greenblatt, in his book, Finally Focused, discourages, he says he doesn't feel comfortable treating above 100 milligrams of vitamin B6 unless there's a shown deficiency. And so I would say 25 to 75 is safe for nausea. Don't go above that unless you talk to your healthcare provider and they give you their blessing. Intervention number 4, we're reaching out a little bit from strong evidence. B6 and ginger have a lot of strong evidence, but I really like number 4 because peppermint tea for me really helps my nausea. Be a placebo, I don't know, but they've studied peppermint aromatherapy. I don't know if that's how you're supposed to do it. That's like a cologne. There you go. I don't know if you're supposed to do it on your hand, but there it is. Aromatherapy for peppermint. They studied it in surgery clients, post-surgery clients, and they studied it in chemotherapy. Oh, my wife's going to show me how to do it. Oh, I feel better now. Thank you. They studied it in chemo clients and post-surgery clients, and they studied the placebo aromatherapy. You know how you create that placebo effect, but they showed that it was more effective over placebo. I read another study very similar, compared aromatherapy, peppermint with placebo. Both groups were lots of benefit to it, but just not one over the other. So the experimental group did not show more effect than placebo. I haven't found any with peppermint tea, which is I personally use. So if you do know of some good research about peppermint tea and nausea, please justify that for me in the comments. Intervention number 5, which I think is a lot of fun, which does have some mixed reviews as well, is alcohol swabs, which is very handy, especially in your hospital. You just had surgery and you do alcohol swab, isopropyl alcohol aromatherapy. The studies had the patients take 3 aromas. I don't want to say sniffs, but sniffs. And what they found is that it worked very quickly, even when compared to Zofran. It worked 50% more effective and quicker. The Zofran does obviously last longer in the system. When they used them together, they found that Zofran plus isopropyl alcohol was also more effective than any of the other groups. There's another article that I read where they try to prevent nausea with surgery patients, and it didn't work at all. As a matter of fact, it made it worse for some reason. It wasn't a huge group, so not a lot to extrapolate from there. But other than nausea can be treated quickly with isopropyl aromatherapy, probably not prevented. There you go. There's my 5 tricks. I know what you're thinking. You're saying, Nick, why didn't you talk about marijuana? There's research to show. I mean, there probably is. It's not really my expertise. But again, I'm not treating this form of nausea of chronic nausea. I'm treating nausea caused by psychotropic medication. Another shout out is acupuncture doing this for this video. Didn't realize how much research is out there for acupuncture nausea. Again, really not what I'm doing as far as this benign, transient nausea, but with more chronic nausea. Maybe something to talk to somebody about. Okay, leave comments. Feel free to subscribe. Look out.